I've heard hospice nurses say, a patient's actively dying, so let's start morphine. Now, let me be clear. This is wrong. This is inaccurate. Just because someone is actively dying does not mean you need to start morphine. Now, you guys know I'm all about morphine education. I'm all about using morphine if it's needed and trying to take the fear out of using morphine. So I'm not anti-medication at all, especially on hospice. However, what I want to do is take away this image of someone actively dying, so you start morphine. That's not how it works. Actively dying does not indicate that you automatically need medication. So let me break down what I'm trying to explain. Actively dying is expected to happen. It's a part of life. It's the last phase of life. Anyone dying a natural death, especially on hospice, will likely get to the actively dying phase, which is when they're fully unconscious, they have changes in breathing, changes in skin color, the death rattle, all these things I've been talking about. That does not indicate suffering. That does not indicate pain. People automatically assume, including other healthcare workers, that the actively dying phase, that's such a natural part of life, is painful. But it's not. It is a built-in mechanism that we have. Our bodies know how to die. Our calcium levels go up, which makes us super tired and lethargic. We are unconscious. We're not even aware of what's going on. Our bodies are usually in ketosis, which actually releases endorphins, which makes us feel better in dull pain. So as a healthcare professional, what we would do at that time would be look for nonverbal cues of someone being in pain. Examples, their brows are furrowed. They look like their face looks scrunched, like they're having pain. If you touch them, they wince or they go like this. They make noises. They're moaning. They're saying they're in pain if they can say they're in pain. Most people in the actively dying phase are nonverbal. So you look for nonverbal cues. So as healthcare professionals, yes, we still have to make sure they're not showing signs nonverbally of being in pain or showing restlessness or showing like the breathing is too labored. Then yes, of course, I would give morphine. If I saw someone in the actively dying phase and I touched them or went to go turn them and they yelled, that would indicate to me they're in pain. Or if the breathing changes they were experiencing, which they will, don't look natural, they look very labored or like really, really hard or fast, yes, then I would give them morphine to slow those respirations down. But that's not always the case with actively dying. Sometimes you can turn them, they're relaxed. They're breathing differently, but their face looks calm. That tells me that they are in the regular, normal, actively dying, expected phase of life, and their body is taking care of itself. Another thing to note, if someone was already taking morphine or already on a lot of pain medicine before they were in the actively dying phase, then yes, for sure, I would still continue giving them pain medicine, because likely just because they're actively dying doesn't mean their pain suddenly went away. That's another time when I wouldn't stop pain medicine or I wouldn't stop giving morphine if they've already been on it. Morphine used as a tool for hospice is a good thing. I'm all for using morphine in hospice, specifically for pain and shortness of breath. Where I think the issue lies is the misunderstanding and the not understanding death and dying, and how our bodies truly are built to do it. And a lot of things that are happening at the end of life are a natural part of the death and dying process, and our bodies are literally built to do it. So the more we can understand that, and the more we see and know how our body actually can help us die when we're dying a natural death, the better we will all be, and the less fear hopefully we'll have around it. First off, I am not in all hospices. I can't speak for every hospice and every hospice nurse. Second, I still don't think morphine hastens death. Like, by no means do I think nurses are giving too much morphine and that's making someone die sooner. That's not what I'm saying. I just think we get certain practices as nurses, and in hospice companies, we kind of perpetuate this problem or education of like what it means to be actively dying, when we start things, different protocols, like all those things matter. This video is meant to help you wrap your mind around the dying process and to learn to understand that our bodies are literally built to live and they're built to die. And dying doesn't necessarily equal pain.